BBC 103.
And we're off to the Health Hub Times Square in Ballincollig, where Anneliese joins me this afternoon. Good afternoon to Anneliese.
Good afternoon, Patricia.
And you are very welcome to the programme with lots of questions coming in. And I saw this one, it came in earlier this hour, proving that COVID has not gone away. Hi, Anneliese. My 14-year-old daughter is just over COVID. She has absolutely no energy, but she also has no appetite. Very tired all the time. Is there any vitamins I can give her? Thanking you. That's from Anne. And can I say, the last time I got COVID, which is about 3 months ago, and it was my third time getting it, and whatever type of strain is out there at the moment, I ended up with absolutely zero appetite for the full certainly the 5 days that I was staying at home. But for about a week, I had no appetite, and it took me another week. I found it really hard to get back into eating. And of course, then that ties in with this tiredness, because if you're not eating properly, you are going to be exhausted.
Absolutely. And when you've no appetite as well, you find you're just kind of reaching for, toast and jam and very stuff that is easy to kind of digest. And of course, there's not much nutrition in that. So I don't know why, Patricia, some people get a loss of appetite, but zinc is very important for appetite, and it's also very important for the sense of taste and smell. And zinc would be another mineral that would be extremely important and used up quite quickly by your immune system when it is fighting a virus. So maybe there's a link. I'm not sure, but maybe there is a link there. So I would recommend for the 14-year-old definitely the Source of Life Gold as a tonic, because it has everything in there. So even if her appetite isn't coming back, she's going to be well covered. It's full of superfoods, so you're not just getting your vitamins and minerals, you're getting all of the other plant-based chemicals that would come with a kind of a superfood diet. Bit of ginseng in there to give her an energy boost. There is zinc in there, but if the appetite didn't come back, you could do an extra zinc. About 15 milligrams of zinc is generally enough. And then the last thing that could be responsible for low appetite is iron. It's less likely in this case, but sometimes when people's iron drops, their appetite drop as well. So maybe, if none of those things work, she could try taking an iron supplement. Like the Floradix is a very easy one to take for fussy teenagers and children, because it comes in a kind of a juice and very, very tasty. So that's Floradix or Floravital, and that could be another option if the appetite doesn't come back.
Yeah. But it's very much there. I was actually at the chemist at the weekend, and I was talking with the young girl in there, and she was saying, it's like it hasn't gone away, but she was saying that they've noticed an increase in people buying the rapid antigen tests. So it's still very much out there. You still have to be aware of it.
It'll never go away, Patricia. Now it's unleashed, so it can't be put back in the box. But generally what will happen is it's going to be like the flu every year,
Yeah.
So there'll be a new strain. People can get vaccinated if they choose to. But truthfully, the best immune protector is actually to get COVID. And the best thing to prevent yourself from getting a very bad COVID is to support your immune system throughout those months. So I would make sure that you're taking a good quality vitamin D, and you can take a full immune supplement that has zinc and vitamin C, selenium, vitamin A, vitamin D in there. There's loads of them in a health shop. Just go in and ask, and they'll give you everything. I think multiple studies have shown that people who either end up with COVID or hospitalised with COVID have compromised vitamin D levels. So without a doubt, vitamin D is the star vitamin in terms of protecting.
Yeah, and we didn't get a lot of sunshine this summer to boost up our vitamin D stores.
Well, I suppose I was in West Cork, Patricia, and I don't know, do we have a particularly good summer? Because I've been fighting with customers here this morning saying, I thought it was grand this summer. So it was cool, but it was dry.
Okay.
But anyway, regardless, no matter even if you've been on holidays, your vitamin D stores will probably run out by the end of October at the latest.
So you need to start taking the supplement.
Yeah, so I always think
clock change to clock change.
Yeah.
I quote you on that all the time. Now, Kay says, advice please on really painful acid reflux. Pain after eating. Proton pump inhibitors don't help. Now, broccoli and dairy make it worse. Pain in the epigastric area and out by my left shoulder blade. Yeah. Kind regards, Kay. Any advice?
So the unfortunate thing about taking the acid blockers, Patricia, they do, if your stomach lining is raw or if your esophagus is raw, acid will burn and will cause pain. But the problem with taking those PPIs, those proton pump inhibitors, they stop the production of acid, and that makes it far more difficult to digest your food. It also makes it more difficult to absorb your essential minerals like calcium, iron, zinc, all of those ones. And they really are only designed for short-term use. If you read the small print, they're not for long-term use. So what you're doing there is you're really just helping to manage a symptom as opposed to dealing with the problem. So in this case here, what I would recommend is slippery elm. This will do two things. You take it before you eat, every single meal, about 5 minutes before you eat. And it will coat the lining of your esophagus and your stomach with a kind of a mucilage that will protect it from stomach acid when it's released. Now, don't come off your proton pump inhibitor for a while because it sounds like there's definitely inflammation in the stomach. Then take something that actually helps to support the mucus cells to produce a thick layer of mucus that protects the stomach, and also that tonifies the sphincter muscle at the top of the stomach that prevents acid from coming up. And that's the key. The two of those, slippery elm and zinc carnosine, is the one that does the other two jobs. And take those for a period of at least 4 to 6 weeks. And then if you want, you can start cutting down on your proton pump inhibitor. And in this case, the other thing I would suggest for this listener is a digestive enzyme, because that pain coming out the shoulder is a real indigestion, can't digest your fats type of a pain and feeling. So get a good digestive enzymes. Udos do a great one. But if you know in your heart and soul that it's fats that really cause the problems, BioCare do one which is called artichoke and lipase complex, and it's particularly good to help you digest fatty foods.
Okay, hi Patricia. A few weeks ago, Anneliese mentioned ginkgo biloba was good for brain fog. It can't be had in health shops, I've tried, and my doctor won't give me a prescription for same. How do I get my hands on ginkgo biloba?
Yeah, and even I'd say, Patricia, if you try and order it from overseas, it could be stopped coming in. So you're just going to have to wait till you go on holidays, or somebody goes on holidays. It can be bought over the counter everywhere in the world except, I'm not sure about that, but lots of places. So if you go to the Canaries, if you go to Spain, Italy, France, Germany, the States, England, you'll definitely get them there. It's the reason we can't sell it here apparently is because it thins the blood, and doctors don't want you to take it with the blood thinner. So, yes, anyway.
But what about people who are not on blood thinners?
Yeah, I know, exactly. And it's been used by the Chinese, Patricia, for over 2,000 years for memory. So regardless of whether there's huge amounts of clinical science behind it, there's certainly a lot of people have been taking it for the last 2,000 years.
And swear by it. Yeah, and swear by it. Hi, could you ask Anneliese, please, what's the best probiotic supplement to buy for good gut health?
Yeah, that's a really good question, Patricia, because it really is difficult to know exactly. Unless you've done a stool test and you know exactly what's missing in your gut, it's very hard. So I think always go for a broad spectrum one. Now, there's a couple of ones that we've been getting great feedback on. One of them is the Nature's Plus Immune Microbiome. There's like 18 different strains of bacteria in there, and that seems to be working very well for as a kind of a broad spectrum probiotic for the gut. I know Terra Nova do a lovely combination. It's the only one that have a combination of digestive enzymes and probiotics. So it gives you both, which will help with the gut. Digestion will improve the digestion, and the probiotics will seed the gut. But I always say to people, if you are taking a probiotic for a longer period of time, try and cycle them, because they all come from different genetic strains and different types of bacteria. So it's like if you plant the same seed in the garden, you're just going to get the same flower growing all the time. So you want to seed your gut with lots of different bacteria. Another one that we get great feedback on actually for the gut as well, Patricia, is the Udo's Super 8. That's another lovely one. So either of the three of those, try them, but then make sure the following month you do a different one.
Yeah, mix it up. Okay, suggestion please. This is on vitamins for my family to take for the winter months. 2 adults and a 13-year-old child. What would Anneliese suggest as a good vitamin to take, an all-round vitamin?
Yeah, like Patricia, I'm not a big fan of multivitamins. I don't take one myself. I think unless the diet is poor, you should be getting what you need from your food. So what I would much rather take is a targeted immune support throughout the winter. And the BioNutri, they do an elderberry complex for adults and for a chewable for kids, and it's incredible. People come back for it year on year. They say that not only does it cut down on the severity if kids get sick, but it cuts massively down on the amount of sniffles and the stomach bugs that they bring home. So I would definitely recommend that or something similar. So it's a BioNutri one, which is a hard one to get unless you've got a practitioner. We have it here in the shop. But if you want to get something similar, what's in it is elderberry extract, antiviral, vitamin C, zinc, vitamin D, and B6 for your immune system. Beta-glucans, which are they're brilliant for promoting your first line of defense, so it kind of deals with any viral infection very, very quickly. And there's also some lysine in there, which is another nice antiviral. So if you can get a combo of those ingredients, but the BioNutri elderberry complex, we sell buckets of it every year.
Okay. Patrick is 61-year-old male who has low iron levels and he's currently on iron tablets. But recently he's noticed his gums have started to recede in several areas, and that's now leading to severe dental pain as a result. Are they linked in any way?
Very likely could be, for sure, Patricia. And it might be directly or it might be in a roundabout way as well. So if somebody is eating plenty of red meat and you're low in iron, that immediately raises a flag for me about absorption and digestion. So the most common reasons that somebody wouldn't be absorbing is celiac disease or gluten intolerance. So I would definitely get checked for that, because if you're not absorbing iron, you're probably not absorbing your other nutrients very well. And then for healthy gums, you'd need zinc, which would be hard to absorb. You'd also need vitamin C. Iron, very important to bring blood flow to the gums. So I think in this case, if you feel that you have any digestive issues, I would definitely go and get tested either for gluten intolerance or celiac disease. And there you're dealing with the root of the problem. And then in the short term, to prevent the receding gums, I would definitely take a vitamin C and zinc supplement as well as your iron supplement. The other thing as well, Patricia, is not all iron supplements are well absorbed. So go for one that's called iron bisglycinate, because that's the most gentle on the system and you'll be more sure to absorb that.
Okay, a parent, what's the best for a child suffering with constipation? Now, they do eat plenty of fibre, they also eat plenty of fruit, but are constantly battling constipation.
So, that's a really interesting case here, Patricia, because I think if people accept constipation so easily, you should be having a bowel movement every single day. And if you're not, and if you're getting exercise, drinking water and eating fibre, it's generally down to a couple of things. The first one would be, if it's just after medication, you've put the bacteria in your gut out. So a good probiotic might sort that out. If you've got kind of bile issues, gallbladder issues, it's probably you're not digesting properly. So taking a digestive enzyme with some good fat-digesting enzymes in there, this probably wouldn't apply to the kid, by the way, but that will sort that. And then the third and the most common reason is food intolerance. And this isn't like an allergy. It's more like you can tolerate it, so you're not having an immediate reaction, but it is affecting your health in some way. It can be your skin. Some people find it can be rashes, acne. It can increase headaches, but the gut is the most common symptom of it. So maybe consider doing a food intolerance test if you rule out all the other reasons. So support with a probiotic and a digestive enzyme suitable for the age. And if that doesn't sort it out, think about food intolerance and do the test.
Okay, do you have a quick fix for wasp stings, asks the listener? The good old Waspies seems to be gone off the market. What would Anneliese recommend? There's a lot of wasps around at the moment as well.
There is.
And they're dying off, so this is the time you'll get the stings.
Yeah, they're lethal. Actually, and I'm allergic and I keep bees as well, Patricia, so I blow up if I get a sting. But I find the best one is Apis meal. It's a homeopathic remedy, APIS, MIEL, and that's very, very good. And then actually, this isn't a natural remedy at all, but I find the Antisan, ANTIHSAN, I think, something similar to that anyway. It's actually an antihistamine cream that you get in the pharmacy, and I put that on, and that takes the pain and the sting out of it very quickly. But if you're allergic or if you react badly, the Apis meal is without a doubt better than any antihistamine. It works very well.
Okay, an email in. What does Anneliese recommend for foot neuropathy? I'm borderline pre-diabetic, says Mary.
Yeah, so foot neuropathy means that the nerves are starting to become damaged down to peripheral, which is toes and fingers really, and it's been damaged by elevated levels of blood sugar. So there is a homeopathic remedy called Hypericum, Hypericum. Unfortunately, the homeopathic remedies have been disappearing off our shelves, Patricia, as well. And that can be good for nerve regeneration, but in this case, really, the key is getting a handle on the pre-diabetes, because that sugar is actually damaging those very fine capillaries and nerves. So taking things like, there was a brilliant supplement that worked amazingly called berberine, which has also been taken off our shelves just recently. So in the absence of that, things that could work well would be alpha-lipoic acid and bitter melon. And they can help improve insulin sensitivity with the pre-diabetes, but you've got to do the diet as well. So you have to do a very low sugar diet. Cut all sugary foods out of your diet completely, and put in lots of fruits and vegetables to get the nutrients in. And then the other thing, in the absence of hypericum, is lion's mane is a mushroom that has found to have some very good neurogenerative properties, and it's a mushroom. It's very commonly bought now in health shops. It can be used for multiple sclerosis, Parkinson's, peripheral neuropathy as well, so worth trying at that as well.
Okay, we'll leave it there. Listen, have a lovely week, Anneliese, and we'll chat again next Monday.
Thanks, Patricia.
Thanks for that. That is Anneliese Dressel of the Health Hub Times Square in Ballincollig.